Glori Hausner, and I'm a physical therapist at the University of Kansas Health System, and I'm here with former patient Joanne Suther. We will be demonstrating exercises that you can do at home prior to your hip replacement surgery. These exercises can reduce pain, increase strength to improve your recovery after surgery. Perform each exercise 5 to 10 times, twice a day with both legs. If any exercise causes pain, don't do it. So our first exercise today is going to be ankle pumps. Joanne's doing a great job with these. You just want to bend at your ankle, pointing your toes up towards you and then pointing your toes away from you. Go at a slow, steady pace, 5 to 10 times. This is a great exercise because you can do it laying down or sitting up. It's really good to help with your circulation, and it helps work those ankle muscles around your ankle that we use to stabilize our feet when we're walking and pushing off to take a step. For quadriceps sets, what you're going to do is tighten your thigh muscle so that you push the back of your knee down into the bed. This is one that you want to do with your legs straight. Joanne's doing a great job. She's doing both legs at the same time. You can do that, or one leg at a time. If it's too difficult, you can also place a little washcloth or towel underneath your knee to push into, just to give yourself some more feedback for the exercise. This exercise works your quadricep muscle, which is on the front of your thigh. We use this muscle all the time when we're getting up from a chair, standing, walking, or doing stairs. So it's a really important exercise for that. For gluteal sets, what you want to do is you can do them laying down, sitting in a chair, even standing if you want, but you want to just squeeze your buttocks muscles together and hold for 5 seconds. Joanne's doing a great job by putting her hands on her hips just so she can feel herself doing the exercise. And if you're doing it on a flat surface, you'll see your hips slightly rise up. These are an excellent exercise to work on your gluteus muscles, which we use when we're standing up. Also use them a lot when we're walking as well. So they're going to be really important to help stabilize your joint. Our next exercise is heel slides. Joanne's doing an awesome job with these. What you want to do is just bend up at your hip and your knee so that your heel slides along the bed. Once you have your knee bent up, you can hold for a few seconds, 3 to 5 seconds, and then slowly lower your heel back down on the bed. This is a great exercise to do because it works the muscles that we use when we're stepping in over a tub, going up on a curb. It's also a great exercise to help with the range of motion or flexibility of your knee and your hip joints. For lower leg lifts, you want to start with a rolled up pillow or a rolled up towel and place it underneath your knees. And then just relax your legs down on the bed. Then you want to just contract your thigh muscle and lift your lower leg off the bed. And then slowly lower back down. You want to make sure with this exercise that you're keeping your pelvis or your hips on the bed, that you're not picking them up. So Joanne's doing a great job with this. This is another great exercise to work on your quadricep muscle on the top of your thigh, which we use that muscle all the time when we're walking, standing, doing stairs. For hip abduction and side lying, you want to start by laying on one of your sides. Your bottom leg can be bent or straight, and then you're going to contract the muscles on the side of your hip, bringing your leg about 6 inches off the bed and then lowering back down. Joanne's doing a great job too of keeping her leg in line, so you want to make sure you keep your shoulder, your hips, and your ankle all in one line while you're doing this exercise. So this is a great exercise to work on the muscles that help stabilize our hips, and they're going to help stabilize that new hip joint. For single leg stance, you want to start by holding on to a sturdy chair or maybe your kitchen counter at home. You want to start with using one hand or two if you need to, and bring up one of your legs so that you're balancing on your other leg. Try to do this for 30 seconds if you can, or if you can't do that right away, just work your way up to that. You want to think about keeping your pelvis stable, not dropping one side or raising one side up. Looking really good, Joanne. And then when you're done, you can go ahead and lower that leg back down. So this is a great exercise to do to help with your balance, which can help reduce your risk for falls. It also helps work on those hip stabilizers, the muscles around your pelvis that we use when we're walking or doing stairs. Thanks, Joanne. And thank you for exercising with us today. If you have any questions, talk to your doctor. Your recovery starts now.